Hello, I'm Councillor Paul Bates, Cheshire East Cabinet Member for Communities and Health. I'm really pleased to share this film with you showing the great work that has been done in the Macclesfield area to deliver services in a different way. Our local community told us their needs and how they wanted us to support them. Focuses on early intervention and prevention services, this work is part of our connected community strategy, which puts residents first and at the heart of all we do. The financial impacts are clear, but I do hope too that you see the impacts to those who benefit from the services, have the ability to change lives for the better. We hope that this pilot project can form a blueprint for other communities wanting to get involved.
Delivering Differently in Neighbourhoods is a Department of Communities and Local Government initiative that Cheshire East embarked on back in 2015. This initiative was to look at service redesign at a local level, involving communities on how they can take part in decision making and be active in service delivery. What we'd like to share with you today is how we embarked on that in Cheshire East, particularly in Macclesfield, and how we delivered it.
So HealthBox have been externally funded to provide extensive community engagement to create and work under the Delivering Differently in Macclesfield brand, which unites service users, residents and service providers. So the Delivering Differently in Macclesfield project works under 4 key principles. The first one is working in collaboration.
The neighbourhood partnerships, which we started to establish just after I got elected, have been really helpful in bringing local service providers and the community together to tackle some of the real issues on the estate.
Knowledge Hub as a provider has proved really useful. It's filled a gap and opportunity that until it came along I wasn't really aware was there. It's allowed us to link in, communicate with other partner organisations.
The second principle is to tackle local priorities.
So we've run a range of engagement events with local residents on the estates. This has helped us to build up relationships with the residents and consult with residents. These events have included things like healthy eating events, baby yoga, summer family events and children's centre events. And due to building up these relationships with local people, it's helped us to then draw down further funding for the area. Some examples of this is the play equipment on Banbury Park and the South Park Action Station too.
The third principle is to support and develop resident-led initiatives.
Intensive engagement with local residents and providers have resulted in the development of these following projects.
My name's Lisa Moss and I'm from the Hope Group Cheshire. And what we basically do is we run a local community group for people struggling with depression and anxiety, mental health issues.
My name is Jill Millwood. I'm from Reach Out and Recover. We're running a live programme in the community to help people that unfortunately are not able to be accommodated in Raw, but where these people, the 3 people with me, Matthew, Adele and Emma, have all been through Raw, are now working in the community just to give people a chance and to guide them along the lines of where they should be going in life, to put them in the right direction of alcohol workers and drug workers.
I'm Adele and I'm representing the CIC Green in the Corner. The CIC we're currently setting up is made up of 9 local residents from the Herdsfield. It's the Adventure Friendly Cafe.
My name's Kate Jaffer. I'm a mental health nurse. I've been a mental health nurse for over 20 years. I'm also a mental health first aid instructor. What we aim to do is deliver mental health first aid awareness training to local organisations who can then roll it out within their companies so that it's in the local community.
My name is Mark Gleave. I lead on the Community Stop Smoking service here in Macclesfield. And the way that we deliver this service differently is because we train up residents who've been through the service to then make it sustainable.
Running each of these resident-led projects through New Economy's cost-benefit analysis tool have provided us with the following results.
The cost of delivering this training is £2,520. The estimated savings from delivering this training are over £16,000.
Total cost over a 12-month period would be just over £3,500 with savings of over £20,000 over the same period.
The cost of this will be £6,000, saving around nearly £30,000.
The cost of this facility over 12 months will be £1,625. The savings well over £30,000.
The cost for this project is £10,000 per annum, and the savings are well over £100,000 a year.
And the fourth principle is to coordinate service delivery.
We're at Elim Church today, which is in the town centre of Macclesfield, and absolutely brilliantly placed to capture the community from the town centre. We would absolutely love this building to become a connected community centre. We are ideally placed in the town centre. We have access to so many services here, and we would like to provide a joined up service. We would like to also draw down funding that would actually give us the ability to move forward and provide better services for the people that we reach to at the moment. We have at least 500 to 600 people coming through Elim in any week, and we would like to provide more for them.
St John's Church was built in the 1990s. It's a very modern church with lots of facilities. We would want to become a connected community centre because we want to serve our local community. We think that we have got the facilities to serve the community, we're centrally placed, and as a church we feel that we should be looking outwards and serving those in the community rather than just ourselves.
The Church of the Resurrection is now called Core. It's been refurbished and it has lovely new facilities. We would be interested in becoming a connected community centre because we can see that this would bring benefits in the form of bringing more groups in, even more groups being more benefit to the community, and more people can take advantage of our new facility.
You only have to see how someone like Maggie from the Elim Church, who cares about local communities and gets over 500 people into a community building in a week, to know that as a council it makes total sense to work with her and to make a difference. The value of working with the local community organisations is that we can listen firsthand what can work, to get in early and transform people's lives. Our early successes with some of our resident-led projects and the innovative way we are capturing savings from these is truly groundbreaking. I'm a complete believer in co-production, which is a fancy word for simple business of working with real people who put their heart and soul into helping others who might not have the same life opportunities as others and making a difference. I'm really grateful to the DCLG for letting us take part in this pilot, which has given Cheshire East a sense of focus and purpose around delivering differently. I'd like to thank the people of Macclesfield in particular that have worked really hard to take the vision that we have had and turn it into reality. As I said at the beginning, if we can learn from this and use it in other areas of Cheshire East and nationally, we are not only connecting communities, we are transforming residents' lives, and it can't get better than that.